No one has tests.
You've heard stories of people with coronavirus-like symptoms across the country struggling to get tested for COVID-19, and a top health official acknowledging that
it is a failing, let's admit it.
So why is it so hard to test for the coronavirus in the United States? To answer that question, we need to go back to January 19th.
The first case of coronavirus has been confirmed here in the United States.
None of us had any idea that 2 months later, toilet paper and hand sanitizer would become the country's hottest commodities. The Centers for Disease Control and Prevention chose to design its own testing kit. In early February, 200 testing kits were shipped to public health labs across the country. That's when things went sideways. Scientists soon realized that most test kits the CDC handed out produced inconclusive results. The CDC would later confirm that the flaws were due to a manufacturing defect.
We know things may not always go as smoothly as we'd like.
States were unable to develop their own tests due to emergency rules triggered by the public health emergency. They were stuck with these flawed tests, unable to determine how widely the virus had spread. It wasn't until February 29th when the FDA finally loosened restrictions and allowed hospitals and labs to conduct their own tests.
The federal government allowed us to do our own testing. Now we are actually in control of the system ourselves.
So what happened during that critical period? On February 26th, the United States had its first
possible community spread case,
confirming health experts' worst fear.
It is not a matter of if, but when the virus spreads into communities in the United States.
The virus might have quietly spread in communities without anyone noticing. Meanwhile, sick people were thrown into confusion and frustration over coronavirus testing. Since there were simply not enough test kits available, healthcare providers were advised to only order tests for patients who met extremely narrow criteria set by the CDC. From January 18th to the end of February, the CDC performed fewer than 4,000 tests. In contrast, by late February, South Korea was already testing 10,000 cases per day. South Korea confirmed its first coronavirus case on January 19th, the same day as the United States. You may ask, why is testing important? Well, testing not only shows how widespread the problem is, it also helps slow down the spread by changing behaviors, especially in people with mild symptoms who may not even know they have the virus. We may never know if the trajectory would have been different with enough tests, but one thing is for sure. The delays in testing set back efforts to contain the outbreak. But here's the good news. States are ramping up their efforts, and the number of tests is going up every single day. Hopefully, we can flatten the curve and avoid the worst-case scenario.